Welcome to Renal Care Radio, offering insights into all aspects of kidney care. Renal nutrition therapy represents a crucial component of managing chronic kidney disease and its associated complications. Traditionally, dietary interventions for CKD have focused on limiting protein, phosphorus, potassium, and sodium intake to mitigate the progression of renal failure and its cardiovascular risks. However, emerging research advocates for a more nuanced approach that considers the individual variability in dietary responses, the stage of kidney disease, and the presence of other comorbidities such as diabetes and hypertension. The traditional dietary approach to CKD management has primarily been restrictive, focusing on the reduction of certain nutrients to slow the progression of renal damage. The National Kidney Foundation and other health organizations have historically recommended diets low in protein, phosphorus, potassium, and sodium for patients with CKD. However, recent studies suggest that a more personalized approach, taking into account the stage of kidney disease and individual nutritional needs, can be more effective. While low-protein diets, LPDs, are standard in delaying the onset of end-stage renal disease and dialysis, research indicates that the degree of protein restriction may need personalization based on patient tolerance, nutritional status, and disease stage. Studies have shown that very low-protein diets, VLPDs, supplemented with keto acids, can be beneficial for patients in the later stages of CKD, potentially delaying the need for dialysis. Controlling phosphorus intake in CKD is crucial due to its role in bone health and cardiovascular stability. Traditional diets limit foods rich in phosphorus, but newer approaches also consider the source of phosphorus, organic versus inorganic. Organic phosphorus, found in natural foods like meats and beans, is less absorbable compared to inorganic phosphorus in processed foods and additives, which is readily absorbed and more likely to contribute to hyperphosphatemia and vascular calcification. Potassium management is complex, as both hyperkalemia and hypokalemia are risks in CKD. The impact of dietary potassium on serum levels is influenced by factors like the type of CKD therapy and medications. Recent guidelines suggest that dietary advice on potassium should be tailored based on serum potassium levels, rather than a one-size-fits-all restriction. Beyond macronutrients, micronutrients play a significant role in CKD management. Oxidative stress is a prominent feature of CKD, contributing to inflammation and cardiovascular risk. Antioxidant supplementation, such as vitamins C and E, has been explored as a strategy to reduce oxidative damage and inflammation. Additionally, vitamin D deficiency is common in CKD, and correcting this deficiency is critical not only for bone metabolism but also for cardiovascular health and immune function. Emerging evidence suggests that dietary patterns may be as important as individual nutrients. Diets rich in fruits, vegetables, whole grains, and fish, such as the Mediterranean diet, have been associated with lower markers of inflammation and better overall kidney health. These diets are typically lower in processed foods and rich in antioxidants, fiber, and healthy fats, which can help reduce blood pressure, improve lipid profiles, and decrease proteinuria. Renal nutrition therapy has evolved from simple restrictive guidelines to a more comprehensive, personalized approach. Understanding the interactions between diet, disease progression, and individual patient needs allows for more effective management of CKD. Future research should continue to explore the role of diet in renal health and the potential for tailored nutritional interventions to improve patient outcomes. Thank you again for joining us here on Renal Care Radio.